Hello, everybody. Welcome to today's or this week's image evaluation series. This week, we're going to talk about the hip. Um, Whenever your provider orders a hip, be it right or left, we're always going to shoot our AP as a pelvis, which is going to include both hips. Okay, which we'll talk about here momentarily. Um, Today, we're going to use the same PACEMAN acronym to go through these images and make sure everything is accounted for and you guys can see what we need to see on a hip x-ray. Okay, so let's get started. Here we've got an AP pelvis. So doctors ordered either a left or a right hip. We automatically know that we're going to shoot an AP pelvis. We want to include the entire bony pelvis, right? All the way from the iliac crest of the ilium, all the way down to as far as we can get down the femur with our film or our IR size. We want to at least include the lesser trochanters right here. Okay, but we've included the entire pelvis here, which is really nice. So position wise, rotation. You need to pay attention to rotation. You want to get your patient as straight as you can on the table. Just makes for a more aesthetically pleasing picture, but it helps you in regards to rotation as well. Keep in mind that for any AP hip or pelvis picture, you want to turn the patient's toes in. Okay, that's going to kick these greater trochanters out and lets the provider or the radiologist see those in profile. Okay, now if you're properly kicked out, your lesser trochanters right here are going to be superimposed by the superior femur. Okay. Now, rotation wise, you want to look at the obturator foramen, which are these two holes right here. The holes are made by the superior ramus right here and the ischial tuberosity, your sitting bones. Okay. Now, if those are symmetrical, that means that you're good on rotation. If one of the obturator foramen is more open than the other one, it means that you're rotated either to the right or left. Okay, so keep that in mind when you shoot your AP pelvis or AP hip. Okay, you want those obturator foramen to be open and symmetrical. Okay, all right. So area wise, position wise, we're pretty good. Uh, Area, we've included everything that we need to include. Okay, we've got the iliac crest right here, or the crest of the ilium, which is this area right here. We've got the actual ilium, which is the paddle of the pelvis. Now we've got the iliac crest, which is this area right here. Okay, and then we go down and you'll note on both sides that it takes an internal turn right there. That is your ASIS, or your anterior superior iliac spine. And down here a little bit lower where you see these little pointy ears, that is the anterior inferior iliac spine, which is less known. Yeah, and you'll hear me talk about the ASIS, or the anterior superior iliac spine, a lot, because that's a popular landmark, especially when shooting hips. Okay, uh, we've got both SI joints demonstrated. Okay, that's where the sacrum actually connects or articulates with the ilium right here. Uh, we've included the hip bones, right, or the superior femur, right. This is where the ball of the femur, or the head of the femur, fits into the acetabulum, or the pocket where your femur articulates with the pelvis. Okay, and like I said before, we're able to see the greater trochanters here in profile. Okay, lesser trochanters are superimposed with the femur, and we're able to see as low as we possibly can and still get the iliac crest in our picture. Okay, we've got L5 demonstrated, and you can see that the spinous process right here is right in the middle of the vertebral body, which is what we want. Down into the sacrum, down into the coccyx down here. Now there's a little bit of bowel gas right there, impeding our view of the lower sacrum, but that's okay. That happens a lot. Okay, so area and position wise, we're in good shape. Uh, Collimation, we've collimated really almost perfectly on this picture because we've included everything that we need to include, right? We're not cutting the iliac crest off. We're not cutting the greater trochanter off, or laterally the greater trochanter cut off. Okay, we want to include those on every AP pelvis that we take. If by chance you cut one of those off, you either need to see if you have more space on one side and move your sensor array in a little bit, or if it's a big pelvis and we cannot fit it on one film, you'll have to take two films. Okay, easy peasy, right? Exposure wise, we're pretty good. We've got a really contrasty picture here, which denotes really good contrast between soft tissue and the periosteum. We're able to see nice, clean lines of the bone or the periosteum. Okay, like I said before, we're able to see the SI joints nice and open on both sides. Uh, the obturator foramen are very, very clearly demonstrated, as is the pubic symphysis right here. The head of or head of the femur right here, where it fits into the pelvis or the acetabulum, is well demonstrated. And again, by turning the patient's toes in, that kicks those greater trochanters out so we can see them in profile. We can see good bony cortical here. We got the surgical neck of the femur right here on both sides. That is commonly fractured in elderly people. Uh, anyway, very, very, very nice picture exposure wise. We're able to see what we need to see. We've got a right marker. Be sure you're using a marker on these just in case that picture happens to come up, inverted. You know which side is which. It's very important that we get the right side. Okay. Uh, Aesthetically pleasing picture. It's very nice. We've included everything that we need to include. Uh, and our contrast is great. We're able to see what we need to see. This is what your AP pelvis needs to look like. And just always remember, when a hip is ordered, you're going to shoot an AP pelvis. Okay, include both hips. Very good. Let's move on to the lateral. We call this a frog leg lateral. For obvious reason, the leg is kicked out, and we're able to see a lateral view of the femur. Okay. Uh, Position wise, our positioning is good, very good on this one. Actually, we've included actually more than we need to. I like to see, the iliac crest up here, and as far down the femur as we can see. No rotation here. We've got the lateral aspect of the right femur well demonstrated. Okay, we've collimated. It's open a little more than I like, but this is a great picture. You're going to collimate a little bit on this one. You don't need to include the entire pelvis. Just make sure you're including the bony pelvis on the affected side, all the way from the pubic symphysis all the way to as far down the femur as you can get. And that's including the ilium right here as well, the iliac crest and the acis and the inferior superior iliac spine right here. Okay. So if our collimation were to go down like this, we would be in pretty good shape. But all in all, pretty good picture. There's no way on earth I'd ever redo this picture. The exposure is very, very good. It's basically the same as the pelvis. When you shoot a pelvis, your picture comes out great. You're going to use that same technique for your frog leg lateral. Just keep that in mind. Okay. We've got a marker there. Very, very nice. We know that that's the right hip we're looking at. Make sure you're marking these. Okay. I just want to note that your centering point for a frog leg lateral is actually going to be your acis. So we're actually a little low on this one, but nonetheless, it's a good picture. Okay. Aesthetics. This is a very nice frog leg lateral. We're able to see a lot of information on one film. So you'll note that on the femur, we're able to see the lesser trochanter right here in profile, and the greater trochanter is superimposed by the hip or by the femur. Okay, it's just the opposite of the AP. That's why they call it a lateral. It's a different view. On the AP, we see the greater trochanter in profile, right? Like this one right here. And on the lateral, we're able to see the lesser trochanter in profile, okay, where the greater trochanter is superimposed by the superior femur. We're able to see the head of the femur going in the acetabulum, and this notes a little bit when we cock the leg out for the lateral, it's going to rotate the pelvis a little bit, and this is what I was talking about on the AP. If you've got some rotation, you'll note that the right obturator foramen is not symmetrical with the left. Okay, you'll note that the left is much more open than the right. That just tells us that we do have some rotation, but that comes along with your frog leg ladder. You're going to have some rotation. But if you shoot your AP hip and you see that your obturator foramen between your superior ramus and your ischial tuberosity aren't symmetrical, you know that you need to turn that patient. Uh, this one is obviously rotated to the right, so that the side that you're rotated to is going to be smaller than the side you're rotated away from. Okay, so we would have to turn this patient back to the left a little bit on the AP. I hope that makes sense. I hope I didn't confuse you, but that's what you're looking for rotation. Uh, but very, very nice frog leg lateral. This is what you want to see. Okay. This is actually a really, really nice hip x-ray. Our AP, we've got everything we need to see there. And our frog leg lateral, we've got everything we need to see here. Okay. And I just wanted to note that if you have a patient that has had a total hip arthroplasty and has a hip prosthesis, you need to make sure that you're including the entire prosthetic on your picture, even if that means you need to take another picture. Okay, here's an example. So this is pretty nice AP pelvis. You can see that the left obturator foramen is a little bit more closed than the right, so he's actually rotated a little bit to the left. You could bring him back. You can actually see that in the ilium. This ilium's a little bit smaller than that one. Okay, so he's a little bit rotated to the left. Okay, and we can't see the right greater trochanter as well as we see the left. Okay, so there's a little bit of rotation, but that's not the reason I'm showing you this. The reason I'm showing you this is we haven't included the distal prosthetic ends. Okay, you take this picture, it's actually okay, but you're going to want to take one a little bit lower. You're going to keep this picture, but you're going to bring your tube a little bit lower. Okay, so you're going to probably cut this off right here at the iliac crest, and that's okay, just as long as you're seeing the bottom of the prosthetic. Okay, sorry, I got a cat in the way. Let's go down here and look at what I'm talking about. So here we've included the bottom of the prosthetic. Okay, note that we've cut our pelvis off at the ACES right here. Okay, but we're able to see the bottom of the prosthetic. Always remember that you need to see the entire prosthetic, and it usually means taking another picture a little bit lower, and that's okay. Just make sure you keep your top one so you can see the top of the pelvis. Okay, this is a nice picture of the entire prosthetic is uh, noted there. Okay, and that goes for both the AP and the lateral. You want to be able to see the entire prosthetic. Okay, well, I hope this was helpful today. Give you a better idea of what we want to see on a hip x-ray. Just make sure you're on your AP, you're including the entire bony pelvis, that you've rotated the patient's toes in to see the greater trochanters, right? And on your lateral, just remember you want to be able to see the lesser trochanter in profile, okay? And the greater trochanter is superimposed by the femur, okay? And prosthetics, you want to see the entire prosthetic because a lot of times fractures will happen at the distal end of the prosthetic. It's a weaker place. Okay, it's kind of a fulcrum. You've got a hard object inside, and sometimes if the mechanism of injury is just right, it'll break at that point. Okay. So just make sure you're including that. If you cut it off, take another picture. Anyway, thanks for joining me today. I sincerely hope that you guys are watching these and putting them into use in your daily. I really appreciate it. I spend a lot of time doing these, and I get very little feedback. I hope that you're using these. The biggest issue that I see is that images aren't annotated correctly. Toes are pointed down, or fingers are pointed down, or images are inverted. Just pay attention to that. If you ever have any questions, just reach out, and I can help you with that. Anyway, thank you so much. You guys are doing a great job. Uh, we'll see you next week. I think next week we're going to talk about the feet. Feet are awesome. So, anyway, we'll see you next time. Thank you so much for joining me today, and have a good day.